Welcome to the first of our three-part special series focused on obesity. This special edition of Diabetes Day by Day is a collaborative project of the American Diabetes Association and the American Academy of Family Physicians and is sponsored by Novo Nordisk and Lilly. Obesity has emerged as a critical and common health issue. Today, we're going to talk about how obesity has increased over the last 50 years, as well as the consequences of obesity. And then we'll discuss an important change in our understanding of obesity from an old opinion that it was due to a failure of will to our current recognition that obesity is a chronic disease. We'll also discuss some of the challenges in getting help with obesity and touch on the way that our treatment of obesity has changed over the last few years. That is a lot that we're going to cover. I'm Dr. Neil Skolnik, professor of family and community medicine in the Sidney Kimmel Medical College of Thomas Jefferson University. And joining me, as always, is my co-host,
I'm Dr. Sara Wettergreen, an assistant professor at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences and an ambulatory care clinical pharmacist.
And Sara, we have two wonderful guests joining us today. Dr. Margarita McDonald, who is an obesity medicine specialist and is medical director of the Bariatric Medicine Institute in Flourtown, PA. Welcome, Margarita.
Thanks for having me, Neil and Sara.
Also joining us is Tamika Holland, who is an elementary school administrator and a person who has obesity and who has been under Dr. McDonald's care for approximately 2 years. Welcome, Tamika.
Thank you. It's such a pleasure to be here with all of you.
Well, it sounds like we have a lot to cover, so I think we should jump right in. Let's start by talking about why we should care about this subject of obesity.
Sara, it is so important because, as we'll talk about in a little bit, obesity has increased so much over the last 40 to 50 years. And when we think about obesity, I think it's important for our listeners to understand that medically we divide the complications of obesity, so why it matters, the complications of obesity into three different areas: metabolic, biomechanical, and psychologic. Now, metabolic means obesity leads to an increase in the prevalence in the number of people who get things like hypertension, high cholesterol, high triglycerides, diabetes, and even fatty liver, which has become a increasing problem over the last decade. And then in turn, it can lead to things like downstream consequences, coronary artery disease, things like stroke. It can also increase other things like some respiratory diseases and reflux. The second large category is biomechanical. Now, here it's not surprising when you think about it. If you have increased weight or essentially an increased load on your bones and on your joints, they'll have more wear and tear. And over time, that's why we find that obesity leads to an increase in the development of arthritis. It makes people have arthritis at an earlier age. It makes arthritis worse. Things like knee arthritis or hip arthritis, regular old back pain, and foot pain all can be more severe than they would be otherwise. The last category is psychologic consequences. Things like depression and anxiety are more common among people who have obesity. Also, obesity can lead to less general energy and general fatigue. Now, Sara, it's critically important to realize that not everyone who has obesity develops any of the things that I said. Just like not having obesity doesn't fully protect you from developing any of those diseases. But obesity essentially serves as a risk factor for the development of the things mentioned. It's also important to recognize that there's a lot that we can do now that includes healthy dietary patterns, exercise, and medications. Sara?
There are just so many pieces that go to the subject of obesity. I think one that's often overlooked is that mental health component and how that affects people in the long term. So I really appreciate you sharing that. Clearly, this is such an important health issue. Now, one thing, I actually read an article about this recently too, but Margarita, can you tell us a little bit more about how the rate of obesity has increased over the last 50 years? It's something we're seeing more and more often now.
Yeah, so the rates have drastically increased. If you look at the rates of obesity in the US in the 1960s, it was around 13% for US adults. Now it is up to 43%. That has a rate that has tripled since then. And if you look at the rates of severe obesity, which is people with a BMI of greater than 40, those rates have risen tenfold since 1960.
Wow, that's just incredible to hear and can be a little alarming to think about. And I'm sure there's just so many different potential contributing factors. I'm thinking about some of them already. But Neil, do you have any thoughts on why that might be?
Yes, Sarah, this has been one of the perplexing health issues of the last 50 years. There's a lot of hypotheses, and I'm going to go over some. I'm not sure we actually can say it is one thing over another, but it's multiple things coming together at the same time. A large effect is environment. We know we live in a world where there's less opportunity for physical activity, which is burning energy, right? Calories. We live in environments now more than even 10 years ago where we're sitting in front of Zoom on meetings, working from home, living in areas for most of us where it's not even easy to walk outside. We hop in our car to go to the supermarket. There's less physical space, and with that, less physical activity. And that goes along, and that's happened at the same time that we live in an environment where there's incredible sophistication of marketing for highly palatable, tasty, unhealthy foods, right? It's very hard to resist when it costs another quarter to supersize your meal. And when we look at the plate sizes over the last 50 years, when we look at the portion sizes at drive-throughs, they're much larger than they were. So we live in what some people have termed a toxic food environment, where there has been overabundance of marketing of unhealthy foods, and also an increase that occurred years and years ago when we thought fat was the big danger. That was replaced with highly processed carbohydrates. So highly processed simple carbs. And I'm going to come back to why that's important in just a minute. So you can see as we describe all this that it supports what has been termed the energy balance model of obesity, that we take more food in, more calories in, we burn less calories, and over time we gain weight. And it's not all volitional, because all of us respond to the environments that we live in. At the same time, another hypothesis, which is really a fascinating one, and I'm just going to touch on, is called the carbohydrate insulin model of obesity. And what that says is that the shift that I mentioned from a lot of fat in our diet to a lot of highly processed simple carbs, when we eat simple carbs, we have a spike in our blood glucose level. That leads to a spike in insulin. What our audience might not know as well as many of our health professional colleagues is that insulin causes that glucose to then go into adipose tissue, into the liver. And what you can guess as I say that is now, since the glucose is being processed, there's a sudden drop in glucose. When our brain sees a drop in glucose, we get hungry and we're driven to eat more. And that model says that it's actually those big drops that lead to overwhelming hunger that most of us can't combat. So it's actually the type of food we eat, not just how much food we eat, the type of food that we eat that leads us to consume more than would be healthy.
I think that just really highlights some of the reasons why we are seeing that rate of over 40% of people in the United States are now living with obesity. It makes sense when you hear all of those reasons. And we can each kind of think about our own lives and think, well, how many times do I drive by a fast food restaurant just on my way home? And on those busy days, the urge that you have to resist to pick the more simple, easy, quick, less healthy option and put a little more time and effort into those options that are healthier. That's difficult.
It is. And I'm really afraid that as much as we've seen this increase over the last 50 years, that we're not done seeing that increase. I don't watch a lot of TV, but when I do, what is so obvious is that one of the more common ads that we see on TV is ads for food. And it's so easy. Like I'm sitting there and those ads are so appealing. I just feel like going on my phone and ordering them in by DoorDash. I don't even have to leave the house. And so I'm very worried that, again, this marketing directly to us that makes things seem so easy might lead to even more problems. Margarita, any thoughts you have?
Yeah, I think that it's interesting that you brought up the marketing part, especially on TV, because it seems that it's almost brainwashed us to think that snacking and overindulgence and nighttime eating and emotional eating is normal. And so when I'm working with my patients, really kind of working on some of that is part of it, because you can watch so many commercials and it tells you to eat when you're emotionally feeling some kind of way.
I think it's so interesting because unless you're very mindful and you have help as someone who's obese to help you be aware of those things, it's easy to have a hard day and say, I'm going to get French fries, or I'm going to get, an egg roll, or something that is, like we've been saying, convenient and easy. And it almost can kind of soothe those emotions. And I think that ends up being the norm, and it is just everywhere. There's TV, there's social media, but it is constant messaging, and you have to be so aware to stop yourself.
Yeah, exactly. And I feel like that media pushes you in a different direction, and you're trying to urge yourself a different way. But I would say the stigma against obesity doesn't help either. I feel like it sometimes limits people's openness in seeking support and management of this. And I feel like for many years, this wasn't even considered a chronic disease. Neil, can you comment a little bit on the thinking of obesity as a disease?
Sure, and it's so important to understand it as that. And Tamika, I love what you said about you begin to feel that it's the norm, and in many ways we have to educate people. That's what we do with these podcasts, so that they understand it doesn't have to be the norm. In many ways, I think back to smoking years ago, where it was the norm to smoke. Now it's not. A change in what we consider our social norms has a large influence in the way we act as individuals. Sara, it's critically important that people understand that obesity is a chronic disease, that it is due to this environment that we talked about, that all of the things we were just talking about. And as a chronic disease, we need to start thinking about it as similar to the way we think about diabetes and hypertension, because we can't attribute fault to someone when there is a disease going on. And there's a lot of science to back that statement, so that once someone's gained weight, all sorts of hormonal shifts occur. Things like leptin, ghrelin, GLP-1, other hormones that cause changes in the way that our body regulates food intake. It essentially causes dysfunctional signaling to the brain that affects the appetite center of the brain, which leads in turn to increased hunger. And it leads to an increased hunger to a degree that very few people can overcome it by just using what I think is often said unfairly by people, a little more willpower. Well, that's not really what's going on. The degree of hormonal changes make that an unrealistic expectation. The other thing that happens is that the body protects its elevated body weight. Once body weight is elevated, the term for that, and Margarita, I know you and I have talked about this a number of times, is metabolic adaptation, which basically means when we lose weight, after a few months, our basal metabolic rate, which means the amount of calories that we burn at rest, actually decreases. And that's what explains what so many of us have experienced, which is when we try really hard to diet, we lose weight on that by eating less for a few months, 3, maybe 6 months. And then without eating anymore, we stop losing weight and even begin to gain some weight back because our body is using less calories. So you can begin to see that this isn't just a matter of choice, but that this fits what is going on with a chronic disease. Recognizing all of that, the American Medical Association and a number of other medical societies in 2013 actually officially declared that obesity is and needs to be approached as a chronic disease.
Margarita, I see you nodding your head in agreement. What thoughts do you have to share?
Well, when Neil was talking about that adaptation, that's what's commonly called the set point. It's that internal thermostat of weight where your body wants to be. And a lot of this that we learned about the set point was from the Biggest Loser studies, the TV show that was on. They followed those contestants, and this is where they figured it out. And so, it just shows us that the neurotransmitters are either not working, not communicating well, the receptors aren't working well, and people can exercise more and eat less, and it just doesn't work. The neurotransmitters just don't communicate because that set point is working against them.
Yeah, that set point is fascinating, Margarita, because it really comes from, we think, way back in ancient times when we're cavemen or something. But at that time, when food was scarce, it was productive for our body to decrease its caloric needs, because otherwise we would starve. But now when food isn't scarce, that same thing that was productive in a different environment is no longer productive. Let me shift gears a little bit. And Tamika, if I can ask you, can you share with us your experience having what we now know as a chronic disease, obesity?
Yeah, absolutely. It was almost like you were just painting a picture of what life has been like, or the long road ahead. I think now, thinking of hormones and what yourself and Margarita had said, it probably was about middle school when I started getting the letters home from the nurse of "you're overweight." And I don't think it was until college that my exercise and my environment, so to speak, really changed. And I started to do the fad dieting. So at one point I was cheerleading. So there was a ton of exercise, very low eating. And then at another point I was working and there was high levels of stress and I was eating on the go, and I just continued to gain weight. And then as a young adult, there was just a stream of diets, the different cups that are different colors. There's this challenge at this gym. There's this random nutrition plan. There's paleo. And it was just a spiral of different things. And while I would get that dip, like you mentioned, for a few months, sometimes maybe a year, the rise would come. And I think the pandemic is what really made that rise continue. Again, I guess the environment, I was very secluded. I was sure I was eating way more than what was necessary. And then my mental health was affected, but I got to the largest weight I had ever reached. And I remember going to my primary doctor, and it was hard to ask for help, right? And asking who I thought was the right person, because for so long it was anything that was marketed to me that I was looking for the help. That's where I was looking for help. But my primary doctor is fabulous. And he was very honest in saying that in his role as a primary doctor, that he doesn't have a ton of training in this area. So he did suggest some sort of keto, but in the meantime, and to look or contact Dr. McDonald. So as I did so, it was great. And I think right away I was validated that this is a disease and there isn't something that I'm doing wrong, because like you mentioned, Neil, it was for no lack of willpower. I was working really hard. And, I think since then it's nice to know that it is a disease and to accept that and to know I'm getting help and I'm making progress.
Tamika, can I ask you a question? You said it was hard to ask for help, which I think is really important for listeners out there. Do you have any thoughts why it was hard to ask for help, and should it be?
Yeah, I agree. It definitely shouldn't be hard to ask for help. However, I think there's a stigma and there's shame,
Mm,
right? I'm gaining weight. I can't lose weight. There's so many standards, especially for young women.
mm,
And it just continues to build. And especially when you're making an effort
yeah.
and things, I think I was pretty knowledgeable. I had worked with a couple of nutritionists about insulin, and I knew about carbs and proteins and fats. And so I felt like all of the groundwork was laid, so to speak, but there was still no success in anything that could stay.
Yeah, no, I'm so glad that you shared that, because I've heard that from so many people that I take care of, and that which is why it is so important for us to understand that obesity is a chronic disease. Very few people find it hard to ask for help with their knee that's hurting them, right? They twist their knee, or for migraine headaches, or we could go on, where it's so clear that people come into their doctor and say, I need help with this. And that's where we really do need to make that shift, so that people understand that this is a disease, and also understand that, like you were able to talk to your doctor, that your doctor could take care of it, or could refer you to someone like Margarita.
Yeah, and I think I'll add, like you said, it's important to know, and like a headache or a knee injury, it is something that's happening to your body. And I'm the first person to notice something and go to the doctor. And I think the real shift for me, or what I would suggest for someone else, is you're taking care of yourself. And it's another form of self-care and taking care of your health.
That's so important. And in every area of our life, we ought to be taking care of ourselves. And there's so much that, whether it's, as you said, shame or time or effort, that gets in the way. But we are the person we're spending the rest of our lives with. So we're important to take care of.
I'm thinking of that too from the stigma piece of, I think some of the stigma comes from the outside world, but then you project it in on yourself, and having that self-compassion that we often talk about in our series here, Neil, is just, this is part of it. Of if you have self-compassion for things like having diabetes, have that self-compassion for what your body size is and what it looks and feels like at a certain time. I remember talking with my aunt, and she had come back from a doctor's office and was upset and saying, they told me I'm obese. I can't believe they said that. And it just reminded me of how powerful language is, the language we use with each other, the language we hear in the media, and how we speak to ourselves. I think that's such a big part of this conversation.
Yeah. And, I have a question, Tamika. It sounds like the doctor who referred you to Margarita really treated you with respect, heard your concerns, addressed it as best as he was able, and then referred you on. Were there any times since childhood that you felt that your interaction with health professionals was not optimal?
I do. And I think that's why I'm always referring my primary doctor and Dr. McDonald, because I think, well, thinking back to middle school, high school, I was still going to like my childhood doctor that my family had. And I remember that she was overweight or maybe even obese herself. And it was almost like it was an annoyance and a due diligence of just, oh, I've got to tell you this. Here's a random weight plan. And there was no support. There was no belief. My voice wasn't heard. So I was shunned. And my primary doctor now that I've chosen, it makes a huge difference that I'm listened to, that I'm cared about. There's always a plan, but I think that in and of itself could be what makes or breaks it for a lot of people, because I wouldn't want to be vulnerable if I knew that I wasn't going to be taken care of.
It's so important. You said that your voice wasn't heard. And I think it's really important. Sara and I talk a lot about patient empowerment. And if our doctor isn't hearing us when we share our concerns about our weight, I think it's okay to pause and say, excuse me, I don't think you're listening. I don't feel like you're listening to me. I don't feel like I'm being heard, because no one can or should argue with the way that we feel. And truly, all of our healthcare practitioners, doctors, nurse practitioners, PAs, I know we want to do our best by our patients, but don't always achieve our best. And when we're reminded of it, that can help a lot.
And as an obesity medicine doctor, we try and make our environment as comfortable as it can. We try and make it so it doesn't feel like your typical doctor's office. Our appointments are a little longer so that we can actually spend time and hear you. And we want this to be the safest place that you can be. Our patients are discussing things with us that they may not have discussed with anyone else. And we are not judging them on anything. We are there to help them when they're struggling, when they're falling, and cheering them on when they're doing well. And it needs to be a safe environment. We all mess up. There's going to be downfalls. We'll have holidays, we'll have birthdays, vacations, all these things that happen that are called life. And it's learning how to manage through it and helping them navigate through it in a safe and supportive way.
It's so important. I think about, Sara, you and I talked with a behaviorist, Aaron Sutton, who brought up the example of, if we're driving in our car and we get one flat tire, we don't say, well, that's the end of the trip. We might as well just poke holes in the other tires. That we all mess up along the way. And Margarita, as you said, we support one another, and then we still move forward. You fix that one tire and you keep moving on. And that's not the end of the journey. Now, Margarita, speaking of journeys, you've been practicing obesity medicine now for quite some time. Can you describe some of the changes that you've seen in approach over the period of time that you've been practicing?
Yeah, so I think, a lot of it stems from the science that we're learning, about the disease process of obesity, the neurotransmitters. And so a lot of the obesity medicine specialists are coming from that point that they understand it's a disease process. So even just the approach to your patients is different. But also we have some really good tools nowadays. The medications that were on the market when I first started, some of them I don't use at all because the side effect profile is so great. While others I may use just as a little jump start or something to help in the end. But the medications that are more recently on the market that are specifically targeting some of these neurotransmitters are attacking almost every part. They're doing the metabolic side, they're doing the behavioral side, the hunger side, and some of them, even with the side effects, it's not the worst thing. It forces people to listen to what their body is always telling them. The food stays in their stomach longer. So if it causes bloating, guess what? It's causing bloating longer. And I think that these tools make it so much easier for my patients to focus on all the other parts of weight loss so that they're not always thinking about food, and they can focus on their behavior. They can focus on their portion sizes. They're not hangry, so they make better decisions. And then when they're really ready, we can talk about how do we introduce some of those things back in life. But it really makes it easier to establish all of those lifestyle changes that we want to do. It makes it so much easier. And also coverage. You know, the amount of coverage that the insurance companies have been doing lately has been increasing over the last, I'd say, 5 years. There's still a big deficit as far as insurance coverage, and insurance is recognizing it as a disease. But here in the state of Pennsylvania, our state legislature passed a law, and the state assistance covers anti-obesity medications. So, you know, I think that this part of medicine is a very exciting part of medicine. We're at a point where things are changing pretty quickly, and I think they're changing for the better, and we are treating it really, truly as a disease process.
That's fantastic. And again, it's really important for people listening to understand, even if you've gone to your doctor years ago and you didn't find it incredibly helpful at that point, just over the last couple of years, this science has changed so much that there really is a lot of help that is available now. We only have a few minutes left. Margarita, any final thoughts that you have for our listeners?
I always tell my patients, especially in the beginning when they're first coming and they're very nervous about things, I tell them that my patients have exercised more and ate less and tried more diets than anyone else. And it's not about doing those things. And it is about learning about the disease process, how the disease process is affecting them as an individual, and how we can help them achieve their goals. And I think it's important for all listeners, whether they're the lay person or the physician, to understand that, because people are still getting physicians that are telling them to exercise more and eat less.
I love your holistic approach, and that comes through as you talk about things. Tamika, your final thoughts.
Just something I thought of, Neil, that kind of bounces off of what you said with going back to a doctor over years. I think recently it's been very obvious that I've lost weight, and as people are like, oh, what are you doing? Again, back to the shame or lack thereof. I'm always very honest in saying that there is a team behind me, and I am on medication, and I have a nutritionist, and there's all of these wonderful things I'm doing. And like you said, the approach is whole, and I'm happy to be where I am. And would you like their information? But that honesty of, hey, I did this thing. I'm being honest with you. You can do it too. But I don't want anyone to think that I'm just magical and I'm working out 5 days a week and this is what happened. But just that honesty and sharing and being proud and happy of where I've come and that it's possible.
Tamika, you're such a wonderful role model for people, and I'm so glad that you've joined us, because I know that there will be listeners out there who will really appreciate having heard your thoughts, and you'll be inspiring for them, and it will help them. Sara, any thoughts that you have?
I want to echo your comments, Neil, to Tamika. Tamika, thank you so much for sharing your story. I think it can be vulnerable and sometimes hard to do that and to share with honesty. So thank you so much for doing that. The final thought I have, coming back to our thoughts around self-compassion, I remember reading a quote that said something along the lines of, you didn't gain all of the weight that you've gained in your lifetime in a day. You won't lose all of that weight in a day either. So have patience with yourself as you consider goals about weight changes.
Sara, thanks so much. And most of all, of course, thanks to our listeners for joining us on this first of a 3-part series on obesity. This is a collaborative project of the American Diabetes Association and the American Academy of Family Physicians and is sponsored by Novo Nordisk and Lilly. We look forward to you joining us for the second part of this series, where we'll be discussing approaches to the treatment of obesity, and then the third episode where we'll focus on talking to your doctor about obesity treatment. If you have thoughts or comments that you'd like to share with us, just call and leave us a message at 703-755-7288. That's 703-755-7288. We'd love to hear from you. For the American Diabetes Association and the American Academy of Family Physicians, I'm Dr. Neil Skolnik.